everyone. We are so happy you could spend some of your afternoon with us for today's learning community for family leaders. As Tiara said, feel free to chat in the chat box and tell us your name and where you are calling from. My name is Melissa Pearson, and I'm the project coordinator for FREDLA. Today's learning community is hosted by FREDLA, the Family-Run Executive Director Leadership Association. As most of you know, FREDLA is a national nonprofit family-run organization whose mission is to build strong, sustainable family-run organizations and together influence policies and practices to support children and families. FREDLA is a core partner in the National TA Network for Children's Behavioral Health, operated by and coordinated through the University of Maryland. This presentation was prepared for SAMHSA, the Substance Abuse and Mental Health Services Administration, under contract, and the views, opinions, and content expressed are those of the author and do not necessarily reflect the views, opinions, or policies of SAMHSA or HHS. We are very lucky and pleased to have the Office of Adolescent Health with us today to speak with us about all of the amazing resources and information they can offer you in the work you do with youth and families. They will also speak with us today about a new initiative called Think, Act, Grow. So I'm really excited to turn it over to Evelyn to get us started.
Thank you, Melissa, and good afternoon, everyone. I'm Evelyn Kapler. I'm the Director of the Office of Adolescent Health at the United States Department of Health and Human Services, and I particularly want to thank FREDLA and the National TA Network for having us with you today. So during today's presentation, I'd like to cover a number of topics. I'm going to talk a little bit about the background for the Office of Adolescent Health, resources that we think may be useful to you and useful at the state and local level, and then we're going to delve into Adolescent Health Think, Act, Grow, or we call TAG, which is our national call to action on adolescent health, and we're going to talk a little bit about how TAG might be used to improve adolescent health and make connections in your communities. So before we begin, I'd just like to give you a little bit of information about the Office of Adolescent Health. We're located within the Office of the Assistant Secretary for Health here at HHS. We're one of 12 core public health offices, which also include the Office of the Surgeon General, as well as 10 regional health offices and 10 presidential and/or secretarial advisory committees. I know that FREDLA works closely with SAMHSA, which is one of HHS's operating divisions, and we also have worked with SAMHSA and partnered with them on the National Prevention Week and Children's Mental Health Week. At the Office of Adolescent Health, our mission is to ensure that America's adolescents thrive and become healthy, productive adults. By way of background, the Office of Adolescent Health was authorized by Congress in 1992, although it wasn't actually funded until 2010. And among our responsibilities, we implement 2 large grant programs, we communicate information about adolescent health, and we lead the national call to action, Adolescent Health Think, Act, Grow. In recent years, there's been increasing attention paid to adolescents, both nationally and internationally. And we know that adolescence is an important developmental period where just a little push in the right direction can have a big impact later on. In 2016, the Lancet Commission on Adolescent Health described the triple dividend. It's an investment in adolescent health that can result in benefits now, benefits into adulthood, and benefits for future generations. Our national call to action, Adolescent Health Think, Act, Grow, is our first step toward our goal of bringing national attention to advance adolescent health. For a quick background, as I mentioned, we manage 2 national grant programs. The first is the Teen Pregnancy Prevention Program, which funds organizations across the nation to implement evidence-based programs and to evaluate new or innovative approaches. The second grant program is the Pregnancy Assistance Fund, which provides wraparound services for expectant and parenting teens, women, fathers, and their families. Some of our grantees may be operating in your communities and would have resources that could be helpful to you. On our website, under the Grant Programs tab, you can find a map for all of our grantees in their respective sections that show you where the grantees are operating and how to contact them if you would like more information. The Office of Adolescent Health website is one of the ways in which we reach professionals who work with adolescents, parents, and other caregivers, and teens themselves. These professionals include clinicians in hospitals and clinics, public health workers, social workers, school personnel, faith leaders, and community service and out-of-school time professionals. Our homepage features links to the 8 sections of the website, and we periodically update the links with the most searched terms on our site, and we also have new resources that are featured in the gray box. So now I'd like to take a few minutes to touch on some of the areas of the website that might be of greatest interest to you. I'll spend some time focusing on the mental health-related information in the following sections, but please, I encourage you to check out the rest of the website as there's a wealth of information. I also want to remind you that you can download the slides and that the URL is listed in the notes section of each of the slides. So if you look at the adolescent development section of our web page, it covers various adolescent health topics such as mental health, healthy relationships, and substance use. We also recently added a section on adolescent development explained, and this goes through the various domains of adolescent development, how they interact and affect each other. For example, you can learn more about how cognitive development affects emotional development, or how physical development might affect social development. We've also developed and posted a downloadable Pocketbook version of this content that can be printed and referenced. In the mental health section, we have information about the basics of adolescent mental health, access to mental health care, and how adults can support adolescent mental health. At the end of the mental health section, we have resources and links to support adolescent mental health, and typically each topic will have a list of similar resources. Another section you might find interesting is the physical health section of the website. Here we have information on the healthcare transition for adolescents. Oftentimes, we know there's a lapse in care as adolescents have more responsibility for their own behavior and as they move from pediatric to adult care. We have information and resources in this section on things to plan for and work on before your adolescent turns age 18. Also, while mental health is sometimes not traditionally thought of as a chronic condition, this section highlights living with a chronic condition and some of the supports and resources available. When we turn to the facts and statistics section of our website, you'll see various statistics and figures related to adolescent health. Here you can find information on adolescent behavior, the changing demographics of America's adolescents, and how they typically spend their time during the week. One of our more popular sections is the national and state data sheets. This breaks down national survey data related to adolescent behavior into national and state pages. We update this periodically as new data is released, and this is usually done once or twice a year. So on this map, you can see the various topic areas and then how you can drill down at the state level for that data. And so this is an example of how the data is presented. This example shows mental health statistics for the state of Virginia, and every state has data that shows the national statistics and compared to the state level statistics. And moving on to the resources and training section of our website, there's a lot of information that will be of interest to FREDLA and that you can access and utilize. There are resources and links from across the Department of Health and Human Services as well as other federal agencies in addition to the OAH grantee-related resources. All of these materials are free to download and use, and I'm going to go through the resources and training section in more detail. So the Adolescent Health Library is located under Resources and Training, and it's organized by the adolescent development topics and contains resources from across HHS to address mental health, physical development, substance use, and other topics. Within this section, the grantee resources developed for our Teen Pregnancy and Pregnancy Assistance Fund grantees may also be of interest to you. All of these are also available for download, and they cover topics such as safe and supportive environments, cultural competence, evaluation and quality improvement, and linkages and referral to services. Under the Find Services, there are links to help find services in your local community. You can go to the website and type in your zip code and find local resources for healthcare, mental health services, assistance programs, and other resources. And under the section Resources for Families, you can find information about how to talk to your teen about different topics. While it may not always seem true, we know that teens listen to parents about important issues. And here you can find information about how to talk to your child about relationships, substance use, money, and other issues facing teens. There are many more resources available on the Office of Adolescent Health website, and I encourage you to explore and learn more. You should all have the hyperlink to the website, and we'll share it again at the end of the presentation. So at this point, I'd like to move on and talk about Adolescent Health Think, Act, Grow. As I mentioned before, one of the ways we're working to achieve our mission to improve adolescent health and to also realize that triple dividend is through our call to action, Adolescent Health Think, Act, Grow, or what we call TAG. TAG was launched in 2014 at the American Public Health Association, and it's a comprehensive, strengths-based, positive youth development approach to improving adolescent health. And our goals with TAG are to raise awareness about the importance of adolescent health, to engage stakeholders such as yourself, to get adolescent health on the national agenda, and to spur action to improve adolescent health. TAG was developed with input from a broad group of more than 80 expert stakeholders representing national youth-serving organizations in 6 different sectors. The original 6 sectors included professionals in the fields of public health, healthcare, education, social services, community and out-of-school time, and faith-based organizations. We came to realize that workforce development is an important part of adolescent health and development, and it was missing from TAG. So in 2018, we pulled together an additional workforce of, we pulled together another work group with workforce development leaders as a 7th section. We also added information addressing youth with disabilities in the updated TAG booklet. We've gathered input through 2 rounds of facilitated discussion with these stakeholders through a webinar platform and had multiple rounds of expert review. The consensus that resulted became the 5 essentials for healthy adolescents that function as the cornerstone of TAG. And these 5 essentials include positive connections with supportive people, safe and secure places to live, to learn, and to play, access to high-quality teen-friendly health care, opportunities to engage as learners, leaders, team members, workers, and coordinated adolescent and family-centered services. To best reach audiences within these sectors and hopefully affect change, we used the 5 essentials as a foundation. And we went through a second round of discussions with the stakeholders to drill down and develop specific research-based action steps that are tailored for each of the 6 youth-serving sectors. The 5 essentials and the action steps were further reviewed by 2 different expert panels, one made up of another group of national leaders, and a second made up of federal experts. We went through a similar but shorter process to develop action steps for parents, other family members, and teens themselves. After developing the action steps, we identified resources to help stakeholders implement them. So you may be asking, how does that work? For example, an out-of-school time or community program leader could go to that section of our website to learn more about why adolescent health is important to out-of-school time and community program professionals and what is important to adolescents. Our intention is that after reading this section, you might become interested in learning more about how you could implement one of the action steps. For example, you might want to help youth connect to supportive adults, positive peers, schools, and the community. By linking to the hyperlink for that action step, you jump down to that section of the page. And here you'll find specific examples of how to help youth connect to supportive adults or whatever action step you clicked on. Recognizing our audience may then ask questions such as, how would I start that? And what would be my outcomes? How could I implement this action step? We have Find More resource links under each action step so that you can get more information. So after clicking through to the resource pages, you would find practical resources on how to implement your selected action step. And these resources for all of the action steps are updated periodically with new information. In the previous couple slides, I showed you one way to use TAG, but there's really no right or wrong way to use TAG. TAG is meant to be flexible, and you can use it as a planning resource, a roadmap, a conversation starter, or as a way to implement a specific action in your own community, organization, or in your own home. You may even come up with a way to use it that we haven't thought of, and we'd love to hear about that. We want TAG to be something that can help generate ideas. The main objective is to improve adolescent health and healthy development. We can all work in our own ways to help reach that goal. I've mentioned before that TAG can be used to make connections in your community. Because it's a cross-sectorial nature, TAG can help to make connections between groups that may not normally consider themselves as having an impact on adolescent health. Many of the action steps and related implementation resources have ideas to help you take the first steps in making those connections. You can also use the 5 essentials, which are the overarching principles for both TAG and the individual action steps. And you can use that as a bridge between groups. So to help make those connections, there are a number of free downloadable resources on the TAG portion of our website that help support TAG implementation and dissemination. The TAG Playbook summarizes TAG and provides information on adolescence, the 5 essentials, and the action steps that I mentioned before. We've shipped playbooks around the country for use in trainings, meetings, conferences, and coalition building. It's been a great guide for us to use to explain and promote TAG, and a great tool for our stakeholders to use and promote TAG themselves. And again, I'd remind you all that you can download the playbook for free from the TAG website. In addition, we've developed a series of what we call TAG Talk videos, which touch on emerging issues in adolescent health. We currently have 5 videos posted on the website. The first addresses how male friendships in early and middle adolescence support mental health, but how this changes by late adolescence and early adulthood. The second discusses adolescent brain development and how that affects decision-making and risk-taking. The third discusses the transition from adolescence to adulthood and how this applies to today's adolescents. The fourth addresses adolescent substance use addiction, and treatment with information on opioids. The last video concerns the Mount Sinai Adolescent Health Center in New York City, which is an adolescent medical home model where integrated adolescent services are co-located in the same facility. Each video comes in a shorter section that can be used in conjunction with related discussion guides for professionals and parents. The videos were co-produced with the Interagency Working Group on Youth Programs, which is a federal working group that runs youth.gov, a federal website with information across the federal government on youth programs. Additionally, there is a TAG toolkit that you can use to help spread the word about TAG and why it's important. It contains sample language for newsletters, sample tweets, and sample posts for Facebook, LinkedIn, and blogs. It includes free banners that you can upload to your website and other ideas on how to connect with TAG. I'd also like to mention the fact that we have a series of research reviews that provide a summary for some of the research that supports each of the 5 essentials for healthy adolescents, which, as I mentioned, are the core for TAG. We also have a number of one-page TAG in action successful strategies, and these feature programs and highlight some aspect of TAG. Some of them have associated webinars that go into further detail about the individual program and what makes them a success. So I'd also like to talk a little bit about the evaluation work that we've conducted with Adolescent Health, Think, Act, Grow. In 2017, we conducted an evaluation to identify TAG's programmatic successes and what factors helped us get here. We used a mixed methods evaluation design with quantitative analysis of program metrics and qualitative data analysis. Existing metrics such as Google Analytics were used, as well as discussions with federal staff and select stakeholders to help our analysis. Through this evaluation, we found a number of successes with improved social media metrics, subscriber numbers, and Playbook orders. We found that engagement with national organizations such as the American Public Health Association and the National Network of State Adolescent Health Coordinators was key to helping raise awareness about TAG. Some of the ways we best engaged these groups was through targeted outreach, presentations, and social media. We also identified some areas for improvement, such as an improved implementation guidance, translation into Spanish, and content better tailored for urban youth or specific geographic regions. Some of our next steps include a planned Spanish translation of TAG and an assessment that will give organizations a way to figure out how to implement TAG based on their own needs. We're also evaluating how TAG materials are utilized by our stakeholders so we can better tailor TAG product development and stakeholder engagement. We've also been engaging with the HHS regional offices and state officials. Since TAG's launch in 2014, we've worked with the HHS regional health administrators on how to use TAG to raise awareness about adolescent health and bring regional leaders together to address this issue. We've also found some state adolescent health departments have integrated TAG in their planning and programming. For instance, the Minnesota Department of Public Health is using the TAG framework to inform their strategic planning around adolescent health. We plan to continue to expand our work with the regional offices, states, and communities and organizations such as FREDLA in the coming years. I've gone over a lot of resources available from the Office of Adolescent Health, and I've concentrated on the mental health resources, but of course all of the topics on the website have some relevance to your work with adolescents. I hope you'll take the time to explore our website and take advantage of the available resources, especially the work being done through Adolescent Health, Think, Act, Grow. So To summarize, I hope you'll join the tag call to action, and on this slide you'll find some ways to connect with us. You can connect through our website. We also have connections through Twitter with @TeenHealthGov. You can also connect with us through our periodic newsletters. Recently, our email provider changed, so if you've received these updates in the past, please go in and check to make sure you're still receiving the messages you want to receive. You can also check us out on the YouTube channel. That's where the videos are posted that I mentioned earlier. Also, if you have tag-specific questions or ideas, please feel free to email us at tagteam@hhs.gov. And I again want to thank you for inviting us to be with you today to share information about the resources available on our website and the work that we're doing to build national attention to the issue of adolescent health through our national call to action, Adolescent Health, Think, Act, Grow. So at this point, I'll turn it back to Melissa, and we'll see if there are questions.
All right. Thank you, Evelyn. I didn't know if you wanted to have anyone else from your team speak at all about anything related to TAG or anything. If we have anybody on the line who has questions, feel free to type those into the chat box, and we'll make sure that our presenters get those. Evelyn, did any of the rest of your team want to say anything?
Well, let me introduce the team that's in the room. I have with me Lisa Zingman, who is a policy coordinator, and she has been the point of contact at the Office of Adolescent Health for our partner engagement work, including our partner engagement work with FREDLA. And then I also have with me Emily Novick, who is our team lead for our communications division. She manages all of our social media work, and she is also the lead for Adolescent Health, Think, Act, Grow. Do we have some questions?
I think one of the individuals was just commenting on how amazing they, that said, wow, great resources. They can't wait to go to your website and explore. And I think, I had a similar reaction to, having you walk through the slides, that I just in so many ways could see how our family organizations and family leaders on the ground could utilize these resources in their day-to-day work with families, in their work with, other stakeholders and system partners that are, coming in contact with families, and just really want to encourage folks on the line to, as Evelyn mentioned, take advantage of the website, explore these resources. I think that, the Playbook, the Pocketbook, all of those pieces could be really valuable pieces to share with families, and, to make sure that families that you're working with know that this website is there and how to take advantage of it. I think we had a question of how can we access the Pocketbook that you mentioned early on in the presentation, Evelyn.
Actually, I misspoke. It's not a pocketbook, but I'm going to turn this over to Emily, and she will explain exactly what it is and how you can access it.
Hi, this is Emily Novick. If you go to the website and go to Adolescent Development tab, and then you'll find the Adolescent Development Explained content, and you'll find a downloadable PDF. And it's a designed PDF document that you can print off and download, and it's in color and nicely designed, and you can print it off and staple it and use it as a resource guide. It encapsulates all of the information that is there on the website, but just in a sort of more sort of designed, easier to use and digest and share format. So that's the idea of the PDF. But yes, I'd just like to echo what was said about encouraging everyone to go to the website, to look around, to explore, to watch the videos, to listen to the webinars, to download the one-pagers. The TAG Playbook, Evelyn said this, but just to repeat, you can also download right from the website as a PDF, full-color document as well. And there are many other resources. And the other one I'd encourage everyone to use and explore is the TAG Toolkit, which is a social media toolkit. So there's all kinds of good stuff in the toolkit that you can use your newsletters and your communications, and if you have a blog or a Facebook page or any of those other channels, you can just use our sample language and download it, and as long as you acknowledge us and include our information about where you got it, all this great stuff, we're really happy to have you use it and share it with your colleagues.
Wonderful, thank you. Yeah, I think, we, Amy, who asked the question how we can access the Pocketbook, found it online from your instructions, so she posted the link in the chat box for everyone to be able to download it. So
great.
Thank you, Amy.
One thing I'll add, this is Emily again, and one thing I'll add, I'd also really encourage folks to check out the TAG Successful Strategies. These are one-pagers that profile exemplary programs that really utilize one or more of the TAG 5 essentials, and it's a really nice short description of the program model, any research results if the program has them, and usually a quote from the executive director, and then contact information, a website, and so forth, where you can go to learn more if you want to learn more about how to deliver services in some of these really innovative ways that people are doing around the country in all kinds of different settings, school-based settings, community-based settings, mobile vans, many, many different approaches, clinics, et cetera. So I'd just encourage folks to check that out.
And we'd love to hear your stories as well. If you have any successful strategies that you think exemplify the 5 essentials within TAG, we'd love to hear about those as well.
We had a comment come in while you were speaking. Elisa said that as a state adolescent health consultant, she's enjoyed using these resources with her community grantees for the MCH block grant, and she just encourages them to use this tool, the TAG tool, to consider what other community partners they can reach out to and how they can better support adolescent health. So I think we've got an example right there of how people are taking advantage already of these wonderful resources and using them as a vehicle to support others in their work with adolescents. And I think, as Evelyn said, if you guys are, if you are visiting the website, downloading these resources, and are using them with families, within system of care communities, within your collaborations with other stakeholders, please do let them know. And we would be also interested at FREDLA to know how you're using them so that we can make sure to share that and encourage folks that we come in contact with as well in innovative ways to use these resources to support adolescent health.
And the playbook, as I mentioned, is flexible, and it really serves as a framework. So, you could pick up on one essential and utilize the resources there if that's a fit within your organization's mission or a particular project, or you can use the whole framework to help guide strategic thinking in terms of an organization's mission and ongoing work around adolescent health.
Evelyn, that makes me think of something I was thinking about when you were talking about the playbook in your presentation. Have you had communities kind of use the playbook as kind of a way to pull together families, young adults, and community stakeholders to kind of have discussions and dialogue about advancing adolescent health?
We have not used it ourselves so much that way, but we have really encouraged our stakeholders to do that, and we do know that in some parts of the country people are doing that. We know our regional offices, for example, have organized conferences, meetings, and trainings are using the playbook. And the folks in Minnesota, as Evelyn mentioned, they used it to really organize their whole strategic planning process, which started with listening sessions that they held all around the state with parents, with teens, with providers. So it has been used that way, and like I say, by states and regions, and we don't use it so much that way here ourselves. But we have other opportunities in which we interact with young people, but the playbook itself is not usually our vehicle. It's more a vehicle we're encouraging our stakeholders to use.
Mm-hmm. Okay. Thank you. yeah, I could see it being something that, our family organizations and family leaders could really use as a jumping off point to, start some dialogue and discussions in their communities about, what young adults and teens are facing and needing, and how as a community they could work together to really promote better adolescent health within their community and their state.
Yeah, and there's some creative things you can do with it. I mean, some people have organized conferences using the 5 essentials as sort of the organizing pillars of the conference, or they just pick one essential to talk about and they ask folks to come and bring their thoughts about how their work fits under one or more of the 5 essentials. So it can be sort of used as an organizing tool or a framework as well for a training or a conference.
Great.
And I think
one of those wonderful ideas.
I think one of the beauties of TAG is that it really is organized by professional sector, and the action steps and the resources behind those action steps are curated, pulled together so that they're specific if you're working in schools, if you're working in healthcare, if you're working in an after-school setting. There are resources and tools available to you specifically. The audience for the Playbook is primarily professionals, although we do recognize that parents and teens themselves often come to OAH for information, and so there are some limited pieces that are specific to caregivers, parents, and teens as well.
Great. Do we have any other questions from folks on the line for Evelyn or any of her team members?
Well, this is Evelyn.
Go ahead. Go ahead.
I just want to thank all of you for inviting us to present information about our website and TAG. I hope that you will avail yourself of these resources, and we would like to hear from you after you've had an opportunity to look at the resources, use them a little bit. If you have thoughts about how they can be used within your network, about how they can be improved or tweaked, please let us know. We also would love to hear back from you if you have examples within your network of what you would consider a successful strategy that aligns with Adolescent Health Think Act Grow and one of the 5 essentials. And I guess in closing, I would just also encourage you to not only check us out on the website, but also to take a look at the 5 TAG Talk videos. I think they're an excellent tool for use when staff trainings, working with parent groups, and given there's a facilitator's guide behind it, it's kind of a ready-to-use opportunity to work through particular issues or educate board members, staff, others on key issues in adolescent health. So again, thank you so much for your time and your interest, and we look forward to continuing to work with FREDLA.
Well, thank you so much, Evelyn. I think that's another great suggestion that I hope folks on the line take advantage of, that, those videos could be wonderful staff development tools and training resources for parent peer support providers, for, family advocates, for family leaders and folks that you're coming in contact with. So, not only within the family organizations, but sharing those with your colleagues across systems. We know that family orgs, come in contact and work with families in all systems, from mental health, education, public health, child welfare, juvenile justice, et cetera. So, if your partners don't know about these resources also, please make sure to share them with them as well, to continue to make sure that folks are able to take advantage of these. And as Evelyn said, be sure to share your feedback about how you're using them. If you've come up with, some innovative ideas about how they can be utilized to support teens and their families, and how you're sharing them, how you're disseminating this information within your communities and your states. So we want to thank Evelyn and her team from the Office of Adolescent Health for joining us this afternoon and sharing all these wonderful resources with us. And I think One of the things that we'll commit to doing, Evelyn, moving forward is staying in touch with our network and our contacts and family organizations and family leaders to encourage them to use these and to encourage them to communicate with you guys about how, if there are things that they see that innovative ways to use these resources and things, that they share that feedback with you guys. So we really appreciate your willingness to join our group and share this information, and we look forward to continuing to stay connected to you guys as you continue to work on these initiatives and on behalf of teens and families across the nation. So thank you so much.
Thank you.
And thanks everybody who's been on the phone. Thank you all for joining us, and if you would please, before you sign off, if you would stay connected for a bit, there is a brief survey. I also want to remind folks that we have our next learning community March 28th at 3 p.m. Eastern Time, and there's a registration link on the slide. If you want to register for that now, we will be talking about a guide that we developed in partnership with Building Bridges for families considering a residential program for their child with behavioral health needs. We're excited to share the development of that tool and the information in that tool with folks next month. So sign up for that, and we look forward to seeing you then. These last few slides give you some of the links that Evelyn mentioned. And again, if you'd like to download the slides that were used during today's presentation, go to the files box just below the public chat box, and you can download a copy of the slides that were used today. So thank you all, and we look forward to seeing you guys again next month on our learning community on March 28th.